Have you made that bold and daring decision to go into the healthcare industry? Are you horribly naive and think you're actually going to help people? This video's for you. So I worked at a hospital for 14 years. And my experience there was not positive, to say the least. That is, considering the organization and not the coworkers that I actually came to like and consider to be my friends. But then there's the rest of them. That's what we're talking about today. There are several things to consider when you go into the healthcare industry. One is to always remember that the organization itself cares nothing about you whatsoever. And healthcare isn't their primary concern. Oh no, numbers and statistics are, which is kind of weird, right? You think the numbers and statistics would reflect on good healthcare. Wrong, because those numbers can always be changed, deflated, inflated, depending on what they want them to show. They can always be corrupted in some kind of way. A patient takes a survey. Oh, for some reason that survey doesn't qualify because they forgot to fill out something somewhere. We'll find it. Negative review, in the trash. Never got it. Happens all the time. Do you think that your job is safe because you've been there for 20 years? No, it's not. And quite frankly, when it comes to the accounting and payroll department, you are now an issue because you're topped out. You cost a lot more for productivity they could get out of a new hire who doesn't know any better, will not get the raises that you got in previous years. Because odds are, younger people tend to switch jobs more often, which means, again, they can hire another young person at starting pay who's only going to be there temporarily, not get the full benefits, leave, be replaced. They want the revolving door. They don't want a dependable employee who, at your age, is now costing them more in time off and insurance. You are a liability. Congratulations. Have you considered why you haven't gotten a promotion in 5 years? Or been offered a new job that you bid on within your department or elsewhere? Have you considered being a complete and total shitbag to your coworkers? Because that is the quickest way to actually get promoted inside an agency. Be the horrible douchebag nobody wants to work with. Not only do you get moved up, you get sent to a new department that nobody knows who you are, your reputation. So you can do the whole thing all over again and make more money elsewhere. And do it again, make more money elsewhere. It's a horrible, horrible revolving door, but for some reason, this is HR's preferred method of dealing with bullies and sexual harassment. No joke. So how do I know all this stuff? Well, let's see here. In my 14 years, I worked for a hospital, an award-winning hospital. It thought it was going places, but it hired a guy who formerly ran an organization with the initials SA. It's a horrible organization that people donate money to. The majority of the money doesn't even go to help the people that you think it's going to. It's going into the pockets of administrators, like most nonprofit agencies. So this guy comes in, and with what used to be, and there goes some partridge, with what used to be a hospital that was growing, it was winning awards. They just built a new facility in 2000. It was expanding into all these different areas, but it became a virus. And it didn't grow into a healthcare organization. it just grew into an administrative shithole of middle management being paid too much to go to meetings that didn't matter, and low-paid employees who found themselves to be miserable, nobody listening to them, equipment that was outdated. You know, in the ER, we had these EKG machines that every morning had to be booted with floppy disk, because buying a new $15,000 machine was too much money. But every time that machine was used, which was several times a day, if you came in and thought you were having a heart attack, you were hooked up to it, $1,200. So you're telling me within a week's time you didn't make enough from the old machine to buy a new and more reliable machine? That's the kind of piss poor management that started running the place. So in my 14 years, 5 of those years I never got a raise. Didn't have any disciplinary action, no write-ups. Always had all my stuff taken care of when it came to annual tests and requirements, yada, yada, yada. But 5 of those years it was, well, we can't afford to give you a raise because, financially we're not doing all that great. Then you read in the newspaper about how the board didn't give the director a raise. They gave him a new job title, which is the same fucking job that he had before, but with a higher pay scale. So that was interesting. Same thing happened with the high management and the middle management. They all seem to have gotten pay raises, but if you're at the bottom of the list, one of the 6,000 employees at this institution that actually ran the place and dealt with patients and did all the things necessary for a healthcare facility, you didn't see shit. So, no promotion. Not really any opportunities to go elsewhere. Unless somebody died. Then you had a job opening, but that was usually taken up by some supervisor's cousin, a distant relative of so-and-so. Oh no, they got squeezed into all kinds of different positions. I knew a guy that worked with a guy, trained a guy, who came in, no previous work experience whatsoever, went to college, I got an associate's degree, and didn't even wait the 6 months to bid on a job, was handed a job as the chief librarian for the library in the hospital, and got like a $5 pay raise. He hadn't even been there 6 months, but he was the nephew of so-and-so. Weird. I'm pretty sure there are policies against that. Then we have the example of somebody I'm going to refer to as Guy LaDouche, who was notorious for sexually harassing, sexually assaulting, and having multiple affairs with different coworkers that he was a supervisor over. You think this would be a huge red flag for HR, considering the possibility of lawsuits, not just against Guy LaDouche, but for the organization itself, because they're the ones that put him in that position of power and authority over these people that he was banging, or attempting to bang, or sexually assaulting in many cases. Yeah. So, you have Guy LaDouche. He's in charge of this department. It's well known that he's had several affairs with nurses and other staff in that department while he's married with kids. And occasionally, somebody will go to HR and say, he fondled my breast, he grabbed my butt, he made inappropriate comments, he whispered the opposite of sweet nothings in my ear. It was an ongoing thing. He was consistently in HR meetings. How he was repeatedly going to HR meetings, I have no freaking idea. But HR also had this weird policy that you weren't allowed to talk about your meetings outside of those meetings. Thankfully, some people did not follow that rule. But, yeah. So, HR basically did nothing. They would say that he's like suspended from his role and has to work as an actual nurse for like 2 weeks as part of his punishment. Then because they were short on charge nurses, he'd go back to his old job telling people what to do, meanwhile trying to get a blowy in like the linen room or something. Yeah. So what ended up happening with this guy? Oh, well, at the end of the story that I know of, he got sent to another branch of the same hospital, to a smaller department. It's more isolated from other departments. And like most healthcare facilities, he was overlooking and supervising a group of women. Fucking awesome, HR. You rock. Nothing like giving a sexual predator the ample opportunity to do horribly, horribly graphic things to people who didn't deserve it because you didn't have the balls to fire someone. Oh, and why did they keep this guy around? He was the only person in the ER, and I have a feeling this was planned, who had certain certifications that the hospital needed to keep their level 1 trauma status. So it was about profit and making sure that they could keep money rolling in from Medicare, Medicaid, insurance companies. The money. It's all about the money. They don't give a fuck about you. They never gave a fuck about you. So yeah, keep that in mind when you go to work in healthcare, or any industry for that matter. They do not give a fuck about you. If it's going to cost them money to fire some guy who is sexually abusing you at work, they're going to keep that guy. It's the sad reality. So that is what I've seen in my time. There's a lot more to it than that. But that is a couple hints, some pieces of advice, some stories to help you in your decision. So you want to go into healthcare, huh? Yeah, you may want to consider something else.